Hi, my name is Hunter, and today I will be performing the insertion of a Foley catheter. So we have our female genitalia, we have a trash or disposal for when we clean the patient and perform the procedure. We have clean gloves, towels, and then our Foley catheter kit along with our hand hygiene. So I do not have any polish or jewelry, nails, anything like that. Okay, so I did want to note that I will be using my own sterile gloves. And then this Foley packaging, I'm using the packaging as my trash bin. However, we would want to ensure that it's the seal has not been broken when we are using this in a live setting. Okay, so I will knock on the patient's room, enter the patient's room, shut the door behind me to ensure patient privacy, introduce myself to the patient, and perform my hand hygiene simultaneously. Hi, Mrs. Smith. My name is Hunter, and I have gotten an order to insert a Foley catheter. Can I go ahead and get your first and last name while looking at their armband to identify the patient? Sorry. So from here, we would explain the procedure to the patient after identifying the patient. All right, Mrs. Smith, we are going to, again, like I said, insert a catheter to help you urinate. We are inserting it due to some urinary issues that you've been having. Do you have any questions? No? Okay. So I will be sure to walk you through every step of the way, explaining the procedure to you as we go. Right, so we'll go ahead and lie the patient back, unless contraindicated. Lie the patient back, bring the table to a working height. We will go ahead and apply our clean gloves. All right, Mrs. Smith, can I have you bring up your knees, okay, and then lie your legs out, okay, great. Does that feel okay? Are you comfortable? Okay, great. So I'm going to go ahead and get you cleaned up, okay? So I'm going to touch you. So we will, when we're cleaning, we will use our non-rinse soap, starting on the side farthest away from top to bottom. Okay, using another part of the towel. Again, same thing, top to bottom. Okay, great. And then again, different portion. Okay, all right. Now I'm going to go ahead and get you pat dried. Okay. And then down the middle. All right, Mrs. Smith. Now I'm going to just go ahead and inspect, make sure we don't see any redness, inflammation, or anything that might be alarming or abnormal. So I do not see anything abnormal or alarming. Okay, and then we're also going to identify the meatus, and that is where we're going to insert the catheter. We want to make sure that we can identify it before further instructing the catheterization. Okay, all right, that portion is done. Excuse me. So we will go ahead and remove our gloves. Okay, dispose, perform our hand hygiene. All right, Mrs. Smith, we're going to go ahead and get our catheter kit set up here. So when we are setting this up, we want to place it on a clean, dry, flat surface, or ideally between the patient's legs. So we're going to place it between the patient's legs here. Okay. All right, so we performed our hand hygiene, we've placed that. All right, Mrs. Smith, so while we do this, please just make sure that you let us know if you experience any pain or discomfort, but also remain still as possible and try not to touch the area that we are working in, okay? So I would remove this as well. So we remove my badge to ensure that we don't break sterility. Okay, so I'm gonna go ahead and get this set up. Give me a minute, okay? And just using our fingertips because we want to be in that 1 inch border. We are going to, yeah, I was confused there. Okay. And ideally, the this last portion would be, this last portion, pull towards us, would be the last step. Okay. All right, so instead of grabbing my sterile gloves, I'm going to put on my sterile gloves here. Okay. And manipulating the hand in. Okay. And then 4. And again, manipulating the hand in. Oof, tight. It's so tight. Okay. However, I've got our sterile gloves on, okay? So I'm going to move this. Okay, put it in the disposal. Alright, Mrs. Smith, I'm going to have you lift your butt a little bit, and we're going to drape this. Okay. So ideally, like under the patient's buttocks a little bit. I'm going to move this because we are, since this is sterile, we're going to drape the patient. Okay, I'm going to go ahead and put a drape over you now. And mine has been manipulated a little bit. So I just need to be really careful with placing it so I can and make sure we're staying sterile. Okay, that's fine. All right, so I'm gonna get this out. Okay, just give me another minute, Miss Smith. I'm going to make sure I have everything prepped and ready. Okay. So I would put some lubricant in here, and I am going to use some of my lubricant because I had a very difficult time practicing inserting without there being lubricant on the tip. Okay, all right, we'll get our alcohol wipes out. Okay, dispose. Making sure that we pull this off gently. Okay. Disposing. Kind of fell about that. Okay. Now put some lubricant. We're going to set it in the lubricant here. Okay. Okay, we're going to attach the 10 mLs to inflate the balloon once we have inserted the catheter. Okay, important to make sure you have everything prepped so you do not have to do it with one hand, as that makes it much more difficult. Okay. All right, Mrs. Smith, I'm going to go ahead and get you cleaned up one more time here. I'm going to touch you again. This might be a little bit cold, just so you are aware, okay? So we're going to go ahead and open or touch the patient, opening the labia, and again, cleaning top to bottom, dispose. Again, other side closest to me, top to bottom, dispose. And then one more, right down the middle. Okay, dispose. All right, Mrs. Smith, we're going to go ahead and insert the catheter now, all right? So go ahead and take a deep breath for me. Okay. All right. Are you doing okay? You're doing great, okay? Okay. So important to note, when you grasp the catheter, you want to grab it 2 to 3 inches from the tip. Okay, so we've seen urine backflash, okay? Oops. Backflash, so now we're going to advance the catheter another 2 inches. Okay, all right, now we're going to go ahead and inflate the balloon. Okay. All right, great job. Okay, now we're going to go ahead and pull back a little to make sure that the balloon has set appropriately. Okay, feel a little bit of tension. Perfect. All right. Okay. Okay. So we'll go ahead and disconnect that. All right, so now we can let go of the labia. Okay. And we can, the sterile portion is complete at this point. So now we will go ahead and clean up our supplies, make sure the patient's comfortable. Okay, so we'll pull this out. Now, when we are inserting the catheter, I did want to note this. When we're holding the labia, I let go of the tubing before I inserted the sterile water for the balloon pump, but I should have continued to hold on to the, sorry, something's dripping back there, held on to the catheter, so in case like she sneezed or something along those lines, the catheter didn't come out, okay? So we'll go ahead and get this all cleaned up now. All right, does that feel okay, Mrs. Smith? Are you feeling okay? All right, great. Okay. So this. Okay. And then clean up any extra mess we might have made. This would all be disposed of. Okay. All right, so from here, just some patient education. We would, well, not only that, but just for this class, we would place this bag below the urinary bladder, and then we would use a stat lock to secure, or stat lock is a securement device to attach the catheter to the patient's inner thigh to avoid the catheter coming out. So, and just having any extra tension. Okay, so we would do that, and then we would also just want to let the patient know that if they were to feel any tension, to let us know, and then in addition to that, educate them on the patient bag, and if they were to be like in a wheelchair or on a walker, it would be important for them to carry it below the urinary bladder. So I think that is it. All right, so I would go ahead and, set the patient up, ensure that they are comfortable, and then from there, ask if they have any questions. All right, Mrs. Smith, do you have any questions or any further questions? No? Okay, great. So from here, I would document the procedure. I would remove my gloves. Okay. Remove the gloves. Dispose in the trash can. And then I would perform hand hygiene. Okay. All right. And then I would ask if the patient needed anything else or anything further. And then I would exit the procedure, or I would exit the room and document the procedure.